Hi, my name is Kathrine Rago. This is my final checkout video for Advanced Health Assessment, Professor White. First, I'm going to wash my hands. I'm going to provide privacy for my patient. Hi, my name is Kathrine. I'm going to be your nurse practitioner for today. Can I please have your first and last name?
Natasha Robinson.
Okay, so Natasha presents to the clinical today to establish care. We're going to do a full head-to-toe assessment. She presents in no apparent distress. She denies all pain. She is well groomed and well nourished. Her mood and affect are appropriate. She was able to provide me her full medical and surgical history along with current medications and any allergies. She's awake, alert, and oriented ×3. First, I'm going to start my assessment by assessing her hair, skin, and nails. I'm going to look at the hands. The skin is intact. Nail beds are pink. Cap refill is brisk, less than 3 seconds, which is a normal finding. Next, I'm going to assess the hair of the scalp, which is evenly distributed throughout. I'm going to palpate for any lesions, any masses, and any tenderness. All is negative. Next, I'm going to assess the skin of the face, which is clean and dry and intact. I'm going to palpate the facial bones, assessing for any tenderness. No tenderness, no masses, or abnormalities are noted. I'm going to palpate the frontal and maxillary sinuses for any tenderness. Do you feel any tenderness?
Yeah.
Okay, so the frontal and maxillary sinuses are non-tender. Next, I'm going to palpate the temporal pulse, which is palpable, +2, and assess for TMJ, if you could open and close. So the joint moves freely and smoothly. Next, I'm going to assess for cranial nerves 5 and 7 by asking Natasha to raise your eyebrows, close your eyes tight, puff your cheeks, and stick out your tongue. So cranial nerve 5 and 7 is intact. Next, I will continue my assessment of cranial nerve 5 by having Natasha close her eyes, and please tell me when you feel this touch.
Now.
Okay, so cranial nerve 5 is intact. Next, I'm going to move to the assessment of the eyes. When Natasha presented to the clinic, we assessed the Snellen chart, which came to a result of 20/20 vision in all visual fields. Next, I'm just going to assess the eyes. They are symmetric bilaterally. There's no swelling, no discoloration noted. Her eyebrows and eyelashes are evenly distributed with no patches. I'm going to assess the conjunctiva and the sclera. If you could look up. The conjunctiva is pink and moist, sclera is bright white and appropriate. I'm going to palpate the lacrimal apparatus, which is non-tender, no discharge is noted. Next, I'm going to assess Natasha's pupils with the light. If you could look straight ahead. So pupils are equal, they're round, and they're reactive to light and accommodation, moving from a 4 to a 2. Next, I'm going to assess the corneal light reflex by shining the light 2 feet away. I see the reflex in bilateral eyes, it's equal and appropriate. Next, I'm going to assess cranial nerves 3, 4, and 6. I'm going to ask Natasha to watch my finger and follow it with her eyes only. Okay, so cranial nerves 3, 4, and 6 are intact. Now I will assess for convergence. So eyes move smoothly and evenly. Next, I will assess for cranial nerve 2, which will assess for peripheral vision. So if you could cover one eye and let me know when you see my fingers and switch.
Yeah.
Okay, so cranial nerve 2 is intact. Next, I will take my ophthalmoscope. And I'm going to assess Natasha's eyes. So I'm looking in the eye, and I can see the optic disc, which is round and intact. I can also see the red reflex, which is a normal finding. The vessels are appropriate and not inflamed. Next, I will assess Natasha's ears. I'll start by palpating the auricles on both sides. Do you feel any tenderness?
Yeah.
They are non-swollen and they are symmetric bilaterally. I will now take the fundoscope the ear canal by pulling the tragus up and back. The ear canal is patent and pink and appropriate. There's no redness noted. The tympanic membrane is pearly gray, the cone of light is present, and the handle of malleus is in the appropriate position. I will now assess for cranial nerve 8 by doing the whisper test. So if you could please repeat what I say.
30, 61.
Okay, so cranial nerve 6 is intact. Next, I will do the Weber and Rhine test. I will take a tuning fork, bang it against my hand, and place it at the top of Natasha's head. She would then tell me if she hears the vibrations in bilateral ears, which would be the appropriate finding. Next, I will assess the Rhine test, which should prove that air conduction is longer than bone conduction. And I will tap the tuning fork, place it on this bone behind her ear. When she tells me she stops hearing it, I will then move it so she hears it only, and she should hear the vibrations longer in front of her ear than on her bone, and that would be a normal finding. Next, I will assess Natasha's nose. It is even and midline to her face. There's no noted discharge, no noted swelling. Her septum is midline with no perforations or deviations. I will assess the nasal cavity, which is patent. The membranes are pink and moist. There's no redness, swelling, or discharge. Next, I will assess Natasha's mouth. The lips are pink, moist, and intact. I will ask Natasha to open up. So the hard palate and soft palate are pink and intact. The mucous membranes are pink and moist. Tongue and uvula is midline. Tonsils are grade 1. I assessed under the tongue, which showed no masses or lesions. The gums were intact and non-inflamed, and the dentation was appropriate. I will now assess for cranial nerve 12 by asking Natasha to stick out her tongue and move from side to side. So cranial nerve 12 is intact. Next, I would assess the gag reflex, which would assess for cranial nerves 9 and 10. I would ask Natasha to open wide. I would stimulate the uvula, which would then cause a gag. Next, I will assess Natasha's neck, which is upright and midline. I would palpate the trachea, which is midline and non-tender. Next, I will go to the back, displace the trachea to palpate the thyroid, ask Natasha to swallow. The thyroid is midline, it's smooth with no nodules. Next, I will assess the range of motion of the neck by asking Natasha to move side to side, lateral, extend back, and flex forward. So range of motion is intact for the neck. Next, I will assess for cranial nerve 11 by asking Natasha to shrug her shoulders against my resistance and turn her head against my resistance. So cranial nerve 11 is intact. Next, I will assess the lymph nodes. I will start pre-auricle, post-auricle, occipital, tonsillar, submandibular, submental, pre-cervical, post-cervical, deep cervical chain, and supraclavicular. All were non-tender and non-palpable, which is a normal finding. Next, I'm going to assess Natasha's lung posteriorly. I'm going to have her turn other way. I'm going to have her take a big deep breath in and out. So lung expansion is even and symmetric throughout. Her breathing is not labored, and she's not using any accessory muscles. I will now percuss the lungs. In all fields, I should be percussing resonance, which I am. Next, I will percuss for the diaphragmic excursion. I should be percussing resonance until I reach the diaphragm where I will get dullness. And that was for diaphragmic excursion. Next, I will assess for tactile freminess by asking Natasha to say 99 when she feels my fingers on her back.
99, 99, 99, 99.
So I would do this through all lung fields, and tactile freminess is present. Next, I will also take the lungs. If you could take a big deep breath when you feel my stethoscope. So the lungs are clear bilaterally. I hear vesicular sounds with no adventitious sounds noted. Next, I will assess for CVA tenderness while I have Natasha in this position. This will assess for any tenderness of the kidneys. So please tell me if you feel pain.
No.
Okay, so CVA tenderness is negative. So now I will ask Natasha to face forward, where I will perform the same lung exam anteriorly for tactile fremitus, even chest expansion, and auscultation of the lungs. I will also be percussing resonance through these lung fields and hearing clear vesicular sounds. I will now ask Natasha to lay flat so I can perform the cardiac and abdomen assessment. So there's no lifts that I can inspect on Natasha's chest. I will now be feeling for heaves or thrills, which I don't feel. Next, I will be palpating the carotid artery on both sides. The carotid artery is +2 and palpable, and I will be listening for any bruits of the carotid artery. So no breweries were auscultated. If I was able to get Natasha at a 30-degree angle, I would then assess for any JVD distension. Now I will auscultate the heart sounds. At the aortic, the pulmonic, Erb's point, tricuspid, and mitral. So S1 and S2 were auscultated with no extra sounds, gallops, clicks, or murmurs. Now I'll have Natasha lay to her left side, where I will listen to the mitral valve with the bell and the stethoscope to assess for any mitral stenosis. So no mitral stenosis was auscultated. I will now palpate the apical pulse, which is palpable +2. I will now ask Natasha to lay flat so I can then examine the abdomen. I'm inspecting for any striae, discoloration, any bumps or lifts or pulsations, which are all negative. I will first auscultate the bowel sounds. In the right upper quadrant, right lower quadrant, left lower quadrant, and left upper quadrant. Bowel sounds were normoactive in all 4 quadrants. I will now auscultate the following arteries: aortic, renal, bilaterally, bilateral iliac, and bilateral femoral for any bruits, and that was all negative. I will now percuss the abdomen. I'm hearing dullness throughout all quadrants, except for the small area of the left upper quadrant where I would hear tympany over the gastric bubble. Now I will percuss for the size of the liver. So the liver is estimated to be 7 centimeters when percussed, which is a normal finding. I'm now going to palpate the abdomen, starting with light palpation and asking Natasha if she can feel any tenderness.
No.
I will then move to deep palpation. Any tenderness?
No.
I will now use deep palpation to palpate the liver's edge, which is palpable. I will now palpate the left side for the spleen, which is non-palpable and a normal finding. I will now ask Natasha to take a big deep breath and attempt to palpate the kidneys bilaterally, which are non-palpable and normal finding. Now I will assess Natasha's extremities, if I could have her sit back up. I will start with her upper extremities, assessing her joints for any swelling or nodules, which is negative. I will palpate the radial pulse or the brachial pulse and the radial pulse, which are +2 and palpable. I will now assess for the range of motion of the upper extremities. I will ask Natasha to lift, move medial, and extend back. I'll ask Natasha to please hold your arms out and flex the fingers and close. Now extend and flex the wrist, and then flex and extend the elbows. So the range of motion of the upper extremities is free and smooth. I will now assess for the sensations of the upper extremities by asking Natasha to close her eyes and tell me what number I'm drawing in her hand.
4.
And keep your eyes closed. And tell me what object I'm placing in your hand.
Paper clip.
Okay, so the sensation of the upper extremities are intact. I will now assess the lower extremities by palpating the femoral pulse bilaterally, which is +2 and palpable, and palpating the inguinal lymph nodes bilaterally, which are non-palpable and non-tender, a normal finding. Next, I will assess the legs for any edema or swelling, which is negative. Joints are intact with no lumps or nodules noted. I will assess the popliteal pulse, the dorsal pedis, and the post-tib. All are +2 and palpable. I will now assess the range of motion of the lower extremities by asking Natasha to just lay back and straighten her legs. Bend the knees, and then just this one knee, move in, this leg, in and out, extend out, move in and out. You can flex the foot and point the foot. So range of motion of bilateral lower extremities is smooth and freely movable. Next, I will assess for the reflexes. I will assess the reflexes of the upper extremities, first with the triceps. So relax your arm, and I'm assessing for that movement. Next, the brachial and the brachioradialis. So all reflexes are +2, and which is a normal finding. Next, I will assess for the reflex of the patellar, which is positive. The Achilles, which is positive, and I will also assess for the Babinski reflex, and Natasha has a normal response to all deep tendon reflexes. Now I will assess for Natasha's coordination. If you could close your eyes, hold your arms out with your fingers, and touch your nose with your pointer finger, both sides. So coordination is intact. Next, I will assess the coordination of the lower extremities by having Natasha take her heel to her knee and slide down on both sides. So coordination is intact. Next, I will ask Natasha to stand, please, with your arms to your side and eyes closed. There's no swaying noted, and then if you could hold your arms up, palms flat. The upper extremities do not drift. So Romberg test shows there is no swaying or unevenness. Now I will assess Natasha's gait, and I will have her walk normally forward and come back heel to toe. And I will have her go back on her toes and come back towards me on her heels. So gait is even and steady. There's no swaying or unevenness. Now I will ask Natasha to slowly hop on one foot and the other. Okay. Now I will assess Natasha's spine. If you could bend forward. The spine is midline and even. There's no tenderness or swelling. Muscles of the back are even bilaterally with no atrophy or deformities. I will ask Natasha to extend the back and move laterally and side to side. So range of motion of the spine is even and moves freely. That concludes my head to toe assessment for Natasha.